Hi, welcome back to my video series on topics to do with pregnancy and perinatal mental health. My name is Dr. Erin Bowen. I'm a clinical and perinatal psychologist and childbirth educator in the Macedon Ranges in Victoria. Today we are up to the letter X and we're talking about X-rated methods to get labour started. Now I'm sure it sounds a little bit like a clickbaity kind of video. I promise you it's not. This is actually pretty important stuff and can be really useful. So let's start with this idea that, okay, so I know not every conception happens with intercourse or even like positive intercourse. There's, people who go through IVF, there's people who go through boring, trying to have a baby sex that's not exactly fantastic. But putting that aside, thinking of times when you have had fantastic, hopefully you have had fantastic sex, the things that go into planning for that occasion, low lights, nice music, kissing, massage, orgasm hopefully, they're all things that are good for setting the scene for labour. Why? Because low lights helps melatonin be produced, all the sort of touchy, nice, feely things, feeling connected to your partner, release oxytocin. And if you orgasm, there's also beta endorphins that get released, hopefully. And these are all really good things for labour, pain management. So it is worth thinking about what's actually, I suppose, agreed on in the medical community. If you're at the stage of pregnancy where you're kind of like, get this baby out of me, there are all the natural things that people talk about. There's pineapple core, but of course the recent research shows that actually eating it doesn't do a whole lot. You have to apply it directly to your uterus, and they've done that with rats, but it's not ideal to do with humans. So that's give it a try if you're desperate, but don't eat too much pineapple core because you'll burn your mouth out, as I discovered after eating 2 of them trying to get my first daughter to move along. Anyway, there's red raspberry leaf tea. Some people swear by it, but there's not a whole lot of scientific evidence behind it actually working. Give it a go if you like the taste. It's not going to do you any harm. That's the main thing. Hot curries, those sorts of things. There's not much indication that giving your baby or your body lots of chili is a good idea either. If anything, you're probably just going to end up with diarrhea and it would be unpleasant. But one thing that the medical community actually does agree on is that sex can help. And if you're in a heterosexual relationship and you can stand the side of your partner, semen has prostaglandins in it, which help to open and ripen your cervix. So having sex late in your pregnancy, again, if you can stand it, is actually not a bad idea, and it might actually help move things along. The other thing, of course, to think about is if you're in a situation where you're in a hospital and you've got pain that you want to manage. It sounds like a kind of bizarre thing to do, but let me tell you, there is a whole lot of research evidence that shows orgasm really helps with pain. So it's not just something, if you're like me, remembering in the sealed section of Dolly magazine, I don't know, a few decades ago, something about, oh, your mum won't tell you this tip, but if you have sex on your period, it's really good for cramps. Well, there's actually some truth in that. So having an orgasm releases beta endorphins, which helps. It's like your body's natural morphine, I suppose, which can be so many more times more powerful than morphine, as I've talked about in my previous videos. So whether you feel up for it or not, it's totally up to you. But the sort of great doula, documentary maker, childbirth educator, Deborah Pascali-Bonaro talks about this idea of, if you want to clear a labour room, get out a vibrator. Nothing clears a room taking a vibrator out in a birth suite. Up to you, but it's definitely something to consider. As I said, the pain management evidence for self-stimulation or, stimulation with a partner is actually pretty good. So there's some tips to think about. If you want to go even further than that, there's this whole world of orgasmic birth. So people who talk about having orgasms during birth, it's a thing. It's been documented. I won't go into it too much because I'd want this to be a kind of short, sharp video, but there's definite further reading to do if you're interested. So I will leave some links below. And other than that, we're nearly at the end of this video series, so I will see you next time. Bye.